Consumer Reports has no financial relationship with advertisers on this site. Women who have heart attacks may face a greater risk of death when treated by male doctors in emergency rooms, according to a new study published in the Proceedings of the National Academy of Sciences. Some 88% of people who have heart attacks live through the initial event, say the researchers. But this study found that female heart attack patients cared for by female doctors were 2 to 3 times more likely to survive than those cared for by male doctors. The researchers say male doctors may have difficulty communicating effectively with female patients and seeing things through their eyes. I don't think this should be interpreted as women should avoid male physicians, says the lead author, Brad Greenwood, Ph.D., an associate professor at the School of Management at the University of Minnesota Twin Cities. But making sure that female patients advocate for themselves and are not dismissed is important. Making sure you're heard is important. Heart disease continues to be the #1 killer of men and women in the U.S., but heart attacks tend to be deadlier for women. 26% of those 45 and older die in the first year after an initial heart attack, compared with 19% of men, according to the American Heart Association. A variety of factors are probably at work. Women have been less likely to be referred for cardiac rehab, less likely to be referred for angiograms and stress tests, less likely to be given life-saving medication when discharged from a hospital after a heart attack, says Suzanne Steinbaum, D.O., Director of Women's Heart Health at Northwell Lenox Hill Hospital in New York City, who wasn't involved in the new research. And women, who, on average, have their first heart attack at age 72 compared with 65 for men, are apt to seek help later than men do, she notes. So what can you do to ensure that you get the right treatment? Plenty. Here's what the research reveals and the steps you can take. What the new study found. For this study, researchers from several universities used data from more than 500,000 male and female heart attack patients in Florida ERs between 1991 and 2010. They looked at the differences in survival rates based on the gender of the treating physician, and found that women were significantly more likely to survive when cared for by a female doctor, suggesting that unique challenges arise when male physicians treat female patients, the authors wrote. Men were slightly more likely to survive when treated by a female doctor, but those numbers weren't considered significant. The study also found that survival rates were somewhat better for both men and women cared for in the ER when they saw male doctors who'd previously treated more women, and when the ratio of female to male doctors in that ER was higher. Typically, say the researchers, about 10% of ER doctors are women. That indicates there is some learning that's going on, says Greenwood. If they male doctors have more exposure to female patients, they learn. As the number of prior female patients increases and the ratio of female physicians to male physicians increases, the penalty associated with being treated by male physicians for female patients is ameliorated. The study does have some limitations, the authors noted. For instance, it didn't explore the possible causes of the gender disparity or consider the potential effects on care from other healthcare providers, such as nurses and residents. Why are women treated differently? Some research over the years suggests that heart attack symptoms may be less obvious and more difficult to detect in women, and that they are more likely to display atypical signs. Other studies, including one published in Circulation this past February, which interviewed people between 18 and 55 after they'd been hospitalized for heart attacks, found that roughly 90% of women and men experienced chest pain or pressure, long considered the cardinal sign of heart attack. The most recent data shows that actually, women's symptoms of obstructive coronary artery disease are generally the same as men's symptoms, says Rita F. Redberg, MD, a professor of medicine in the UCSF Division of Cardiology. In general, women are slower to seek help and slower to receive help and diagnoses after the visit, but it is not related to atypical symptoms in women, it's more related to the mistaken conception that heart disease is a man's disease. Still, the February study found that women were more likely than men to report other symptoms in addition to chest pain, such as nausea or discomfort in the jaw, neck, arms, or between the shoulder blades. Multiple symptoms may muddy the diagnostic waters, according to an editorial published in Circulation in February 2018. When this happens, patients, family members, and healthcare providers are often less clear that the heart is the source.